Hey guys, welcome back to allornonelaw. This is quick internal medicine, and today we're gonna discuss about EKG, electrocardiogram, and today's topic of discussion is are QRS complexes too small? Are they small? Well, let's start a basic rule. The QRS complex, okay, QRS complex is gonna have a different shapes in 12 leads. In each leads they're gonna have different shapes. That's why we should know what is the normal variation of the QRS complex, right? Now remember, if the QRS complexes are very small, what does it indicate? What does it indicate? Means that indicates that the QRS complexes indicates that there is what you call a little of voltage generated by the ventricular depolarization is reaching the electrodes. If this is a heart, okay, if this is a heart, and I don't know why chest, okay, I have to draw like that actually. Okay, the ribs are like this, okay, and the voltage, the what you call the voltage generated by the left ventricular depolarization is reaching the electrodes very little. Means the current reaching the electrodes is very low. Means if I have to tell you, if this is a heart, okay, and ventricle, the generated what you call is reaching what you call, if these are the EKG leads, and the power, the voltage generated by this ventricle depolarization is reaching the EKG very little, means very slow. What does it indicate? There is someone who is obstructing over here. Means, now let's talk about this. Remember one thing, that when there is a small QRS complex, first thing you should always ask yourself that whether the EKG caliber is corrected or not. EKG caliber, if it's what you call incorrect, correct it. What's the corrected caliber? It should be of size of 1 millivolt equals 10 millimeters. 1 millivolt equals 10 millimeter. Remember, that should be the caliber. Okay. So now there are two things: whether the EKG, the distance between the what you call, there is a gap between the what you call either EKG lead and the left ventricular depolarization current. If there is a gap between there is something that is obstructing. That is what you call because of that the EKG leads are getting very low voltage current from ventricular depolarization, right? So what are the causes? What are the normal non-cardiac causes for that? Either the patient is obese because of a lot of fats, lot of muscles, the voltage current from the depolarization, ventricular depolarization is reaching very little, very low to the what you call your EKG leads, okay, and other it could be non-cardiac cause like emphysema, okay. So if these two conditions can be non-cardiac causes for small QRS complex. What is the cause? What is the cardiac cause for this small what you call QRS complex? It is, if there is a, I think you came to know across, right? If there is something that is what you call, there is something between the heart and the EKG leads, there is a fluid over here. What is that condition known as? Of course, it's known as a pericardial effusion. Pericardial effusion. If patient has a pericardial effusion, then you will get what you call small QRS complexes. Okay, right? But remember, the pericardial effusion patients will have other important EKG finding, that is electrical alternance. Electrical alternance, right? What is it? In which the height of the R waves or T waves alternates from beat to beat. R and T varies from beat to beat. Okay. So very important thing we discuss over here. Okay, if the QRS complex is too small, one thing remember guys, there's not exactly the size of what you call QRS complex. We can say it should not be like, as we said in the R wave, that it should not exceed 25 millimeter. We cannot say the exact size over here of the QRS complexes. Okay, so it all depends either it is too small or not. Okay guys, so try to remember these things. This is really very important point what we discussed over here. Okay, remember, as I said, criteria exists for a normal upper limit of QRS complexes size. Okay, there are no similar guidelines for lower limits of QRS size. Very important. Okay, so thank you so much for watching this video. Take care.